Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T UVerse on Channel 99. I'm Dr. David Bali, and I'm your host for In a Heartbeat. Heart disease remains one of the leading causes of both hospitalization and death in the United States today. How do you recognize the symptoms of heart disease, and what are the important steps that you should take if you think you may be having a heart attack? Well, my special guest today will help us sort through some of these very important issues, as well as share with us exciting advances in technology, research, and treatment. He is also often mentioned as one of the leading top physicians and best cardiologists, and he's also Chief of Cardiology at St. John Hospital and Medical Center. And his name is Dr. Thomas LaLonde. Dr. LaLonde, welcome to In a Heartbeat.
Thank you, David. My pleasure to be here.
It's our pleasure to have you.
Thank you.
I know you have a lot of great things to tell us about, especially when it comes to new advances in technology and the lab that you have going, and we're going to get to that a little bit later.
Great.
But to start out, Dr. LaLonde, maybe you could share with our viewers a little bit about your practice and the patients that you see and the scope of the different things that you do.
I'm a practicing partner of East Lake Cardiovascular. It's a 15-member group specializing in the whole spectrum of cardiovascular diseases, coronary disease, heart failure, hypertension, hyperlipidemia, high cholesterol, peripheral arterial disease, blockage in the arteries in the legs and outside of the heart, the carotid vessels. So we cover the whole spectrum of vascular disease in general.
It's really a huge area.
It really is, and it continues to evolve with our ability to diagnose these things. And I think the beauty of what we do, we're now able to diagnose heart disease and vascular disease early in its onset. It's not unlike cancer. If you catch cancer early, you can take care of it. Same with vascular disease. Catch it early, you can prevent the devastating consequences of the disease, which is stroke and heart attacks and death.
Dr. LaLonde, to start out basically, what really is heart disease and what are the different aspects of that?
Well, heart disease is a whole continuum of diseases. Coronary disease is the most common thing we see and most common thing we treat, and that's blockage in the coronary vessels that ultimately can lead to heart attack and death. But we see primary myocardial disease of the heart muscle with many causes of that can lead to heart failure, hypertension and its effect on the heart and the brain, arrhythmias, irregularities in the heartbeat that can cause symptoms for patients and can be devastating in some patients. Ultimately, it may lead to a defibrillator, for instance. So heart disease itself covers a wide spectrum of many, many disease processes.
And what are the major risk factors for heart disease, and what can patients do to perhaps proactively help to prevent that?
Well, I think every patient, including adolescents and teenagers, should understand risk factors and know what their risk factors are. So the 5 that we know about are family history or genetic predisposition. That's extremely important. Unfortunately, that one you can't change. You can't modify that one.
Where are the genes that we were born with?
Unfortunately, we have that. We have to play with that deck of cards our whole life. Smoking, and smoking to me is the most significant risk factor because that's one that can go away. Hypertension, diabetes, and high cholesterol. So those are the 5 that we know about, and I think patients should know their numbers. They should know what their cholesterol is, including their bad cholesterol. They should know what their blood pressure is. They should know what their blood sugar is. And there's risk factors that we don't have a good handle on yet. Chronic inflammation, for instance, can lead to heart disease. And there's things in the environmental factors that we're beginning to understand but don't have a handle on yet. But the 5 we know about, we have to identify those and work hard at modifying them.
Sometimes we're seeing more often that patients who have chronic inflammatory diseases such as psoriasis or arthritis or those types of things may be at higher risk for for heart disease?
I mean, there's no question. We actually can measure the degree of inflammation in the body by something called a C-reactive protein. And there's a high sensitivity lab test that can detect that for us. We don't have a way to modify it specifically just yet, but it does identify a patient who may be at high risk, so that if they have the other risk factors in combination with a high CRP and chronic inflammation, we need to work harder at modifying the ones we can fix.
Dr. LaLonde, how do you screen for heart disease, and how do you make that diagnosis?
Yeah, you know, I think it's a very, very good question, because it's been a difficult question for many years. I think most patients think that a simple EKG can screen for heart disease, and you go to your family doctor, get an EKG, and it looks normal, you feel good about yourself. Unfortunately, it has no negative predictive value. A normal EKG means nothing. You can have 90% blockage in every vessel, and the EKG can be normal. It has positive predictive value, meaning if it's abnormal, there probably is a problem, but no negative predictive value. Unfortunately, the next step is a stress test, and even a stress test will only pick up a disease bad enough to limit the blood flow at the level of exercise or stress that you put the heart under. So it won't pick up a 40 or 50% blockage, which could ultimately lead to a heart attack. The best screening test, in my opinion, and this is evolving with technology as it goes on, is the CT angiogram. It's actually a CT scan. We insert a simple IV, inject dye, and take a CT scan. In fact, it takes as long as it takes you to hold your breath, that's how long it takes to do the test.
That's pretty short.
And we actually see the vessels, and we can see the lumen of the vessels, so we can identify patients who have blockage that are undetected. And at that point, then we can work very, very hard at modifying the risk factors that ultimately may have led to that blockage.
I think you probably see patients like this, and I don't know that everybody necessarily understands it as a patient, that sometimes I think people feel that, well, I don't have any chest pain, I'm okay, I don't necessarily need to go to my physician for a checkup. And what would you say to that?
Well, I can't stress this point enough. We know very well that the absence of symptoms, unfortunately, means nothing in terms of heart disease. You're not fine on Wednesday, develop heart disease on Thursday, and have a heart attack on Friday. That doesn't happen. There's so much silent heart disease out there, and it's devastating. There's probably not a week goes by that I actually don't see a patient in the emergency room with a heart attack, or even worse, sudden death as the first sign of heart disease. So this screening process is very, very important. I think it's also important to understand that vascular disease is a diffuse process. So screening for blockage in the legs or blockage in the neck, which can be a very simple test, also can identify a patient who has vascular disease, and it is a diffuse process. If you have blockage in your heart, you likely have it in your legs or your neck, and vice versa. So we just need to identify patients with vascular disease in general.
Dr. LaLonde, what are some of the most important symptoms of heart disease, and what really is going on symptom-wise when a patient is experiencing the onset of a heart attack?
Yeah, I think the classic symptoms, of course, are chest pain, tightness, or pressure in the chest, typically brought on by some degree of exertion or stress, relieved by rest. Those symptoms oftentimes are associated with sweating, diaphoresis, shortness of breath. But I think you and I know very well that patients don't follow the textbook all the time, and there's many, many non-specific symptoms of heart disease, such as fatigue, unexplained shortness of breath, even nausea when you're active that is unexplained can be a symptom, a non-specific symptom of heart disease.
And in recent years, we found out that there are different symptoms often in women compared to men.
Yeah, I think you know, we've learned that lesson through tough experiences over many, many years, that women often present with very atypical symptoms of heart disease, such as fatigue, unexplained shortness of breath, and very atypical type of chest pain, the kind of chest pain that on the surface wouldn't really seem like pain related to the heart.
I think an important thing that you can help our viewers with is, say for example, somebody thinks that there may be some possibility they may be developing a heart attack, or their loved one is, or they're around that person who may be having one. And what would you say to them? What are the important critical steps that that person should take in order to do the best they can to get the best outcome?
Well, you know, many years ago when I first finished training, probably about 10% of patients died of a heart attack, even if they got to the hospital, because of our inability to really treat the underlying problem, and that is open the blocked vessel. Our technology has evolved beautifully over so many years that now if a patient gets to the hospital in a timely fashion, we can whisk them right up to the cath lab. Typically, we'll find a vessel that's 100% blocked, and we can open it up very quickly. And the time limit where we can save the heart muscle is 90 minutes from the onset of symptoms to the time we open it up. If a patient gets to the hospital, we can do that very quickly. So if a patient in the least bit feels that they're having a heart attack due to chest pain, unexplained sweating, nausea, they need to call 911. The beauty of calling 911 is that we have implemented technology that allows the EMS personnel to obtain an EKG at the house, transmit it to us at the hospital, and if we can identify a patient having a heart attack, we'll call our emergency team in as the EMS is bringing the patient to the hospital, and we're waiting for the patient.
That's great.
And it is, and if we can get them up to the cath lab, open that vessel up. I mean, I've had patients who have had a massive heart attack, come in with a massive heart attack and leave the hospital in less than 48 hours with a normal artery and a normal heart.
What about the thought of even maybe just taking an aspirin after you've called 911? Is that beneficial?
It's very beneficial because the first thing EMS will do in that setting is give the patient an aspirin. So it's very important. The beauty of the aspirin is it inhibits the platelets from clumping together, which is the first nidus of a blood clot.
Dr. LaLonde, you mentioned peripheral artery disease. What is peripheral artery disease, and what is its relationship to coronary artery disease?
Very good question. I think everybody understands what coronary artery disease is, or at least they should have some handle on it. That's blockage in the coronary vessels. Peripheral arterial disease is the same disease process in the periphery, in the vessels, typically in the legs. Severe peripheral arterial disease can cause pain in the legs, just like you would get pain in the chest with activity. Critical peripheral arterial disease can actually lead to limb loss, amputations. The importance of identifying people with peripheral arterial disease is that they don't typically die of their peripheral arterial disease. They die of coronary artery disease because the two processes are intimately associated with each other. Once we identify a patient with peripheral arterial disease, we work very, very aggressively to prevent them from progressing to coronary artery disease.
And what are the different treatments available for peripheral artery disease?
Well, the first treatment is to identify a patient, hopefully early in its course, and to modify the risk factors that ultimately led to the disease. And we've already talked about that, the diabetes, high blood pressure, smoking, high cholesterol. But once we identify that, walking is the most important treatment, to continue to walk to increase circulation to the legs. Once the blockage gets bad enough to cause symptoms, then we'll bring them to the cardiac catheterization laboratory, identify where the blockage is, and we have some amazing technology and tools to help patients with this disease. Atherectomy devices where we can actually cut away plaque, remove the plaque, balloons, laser devices that are much more beneficial in the legs than they actually are with the heart.